বাবু আমি আসি বলেছি না, আমি আসি, তা তোমার কি অসুবিধা বলো? কি হয়েছে তোমার? কি তোমার এই মুহূর্তে কি বলো? আমি আসবো তোমার কাছে।
Housing.
Yeah.
That's why we met. Our continued connection has been because at that time I created a case file for you. We've returned to connect numerous times.
Yes.
Sometimes out of that necessity.
Yes. Always was that necessary.
And at this time I'm helping you to do these economic services calls, and my hope is that we'll be able to get an ID for you and a social security card to start working towards housing.
I am referred. You came into me, then now this every coordinating, housing coordinating, who are you reporting it to?
Either the path grant, I guess, is
Path
where
grant under who?
Under the path grant is a federal grant, so it's created by the.
But on that grant,
I think the guy that there's a new Adnan.
But you work for
CHC.
CHC. Okay. Now you are helping me with the housing, right?
Mm-hmm.
The coordination at the Days Inn.
Mm-hmm.
The coordination was kept me in the dark. It was 2 days, and then when I checked in, it was 1 day.
Mm-hmm.
Is that true?
Yeah.
Yeah.
That's what happened. Yeah.
That's what happened, and after that, for me there was no hotel in Chittenden County.
Mm-hmm. You called again. It sounds like they said no. There's no hotel. That Sunday, you called 211.
Yeah.
So there was no hotel the second day, even though they said there would be.
And it gone week by week, many weeks.
And then after that, I think I tried to get in touch with you that Monday. I believe you were in the hospital or something along those lines. I think that Tuesday we connected. We got you. I forget if there was anything.
After few weeks, we got the next one in coordination. We found Rothland.
Yeah.
The Quality Inn.
Yeah.
That one also, the coordination kept me in the darkness.
Mm-hmm.
The housing coordination, it was for 2 days, and then kept me for a whole week, another extension.
Mm-hmm.
I check out from there. That also a ill coordinated knowledge given to me. Checkout date
Mm-hmm.
is different than they was given to me, right? Same thing happened at Rockland.
Yeah, I can't off the top of my head.
So that's why I was always telling you,
Yeah.
you know, to write it down,
Yeah.
to
Well, and in this
to
case-
coordinate
Right.
in email.
Yeah.
Right.
In this case, it was the second. We had an exchange yesterday where I was telling you that they said it was a week last Thursday.
Right.
It was this Thursday. It was on my calendar,
Mhm.
and that's why we planned to connect this morning to
No,
do this call.
that this at the schedule on that coordination I was being sent until May the 6th, right?
Mhm.
That was the coordination.
So this must have been a mistake that you were told that, but we
But-
are here right now on the second, having coordinated this.
Yes, that's
Right.
what we did, because it was ill knowledge given to me. It was when last coordination happened.
Mhm.
It was told me it was until the 6th.
Yeah, it sounds like that was a mistake. Between
Same
us.
thing.
Yes.
Right? It's over and over happening.
Yeah.
You know,
Um,
it's a very uncertain moment to me, right?
yeah.
But
In
Dr.
this-
Lincoln Heath,
Mhm.
Lincoln Heath or Seth,
Heath.
Lincoln Heath, right? And he has. I never went to see him.
Mhm.
How I don't know. How
You've come to Safe Harbor before. I believe you
yes.
have a medical chart.
no? I have a chart. That doesn't mean.
Yeah.
That doesn't mean that I gave him. He's my doctor.
Yeah. But I
No.
didn't say he's your doctor.
No, that's what I am saying. I'm not saying you,
Yeah.
but you are reporting to him, and he is the part of that team, you know, who is coordinating the housing and my vulnerability.
No.
So
no, I'm
who
sorry.
then?
I need to get to the next client that I have.
Okay,
I'm
who
running
is
late.
then? Who is then? Can you give me the information? Why, or to
It
whom
sounds
you
like
report?
I need to summarize to you how this
No,
who has access to this information.
Yeah, and
Yeah.
who you report?
Okay.
That's all I want to know. Who you report?
Okay.
At the CHC Community Health Center.
Yeah, I report to Leighton Johnson is a therapist. That's who I. That's who
Lincoln Johnson.
Leighton.
Leighton Johnson.
Leighton Johnson.
That's not a doctor.
He's
I
my
have-
supervisor.
Okay.
So is that what you're wondering?
Yes.
Yeah, Leighton.
What is designation?
He's a therapist there who is
Thera-
also my supervisor.
Therapist on what?
Or as he's what do you mean on what?
Therapist. Is he a doctor or he's a therapist of what?
A licensed social worker.
Therapist is a social worker.
He's a licensed
Licensed
therapist, social
therapist what? A therapist on what?
worker.
Can you
Mental health,
explain me?
mental health counselor.
Mental health.
Yeah.
Who sent me there? After all, are you from there too? All right. Thank you
Yeah.
for the information you gave me. Right?